Dr. Jennifer Vialta, but my patients know me as Dr. Jen. I'm a pediatric dentist with a master's in public health, and I practice in beautiful Los Angeles, California. Today, my assistant Betty and I would like to go over some tips and tricks that you can use at home to help prevent cavities in your children. Did you guys know that 40% of kids, by the time they start kindergarten, will have one or more dental cavities? That's insane. My goal is to help you learn all the tips and tricks that I know so that you can help prevent the #1 most chronic disease, which is dental cavities, from happening to your kids. So let's get started. So first things first, it's very important to understand what is dental plaque. I get that question a lot. Dental plaque is formed after you eat something or drink something that isn't water. It forms because the bacteria in your mouth, or I like to call them sugar bugs, the sugar bugs eat whatever you eat. That's what I usually tell my patients. So after you eat, if you don't brush, if you don't floss throughout the whole day, you're allowing the bacteria to eat all of the leftover food that's on your teeth, which is nasty. After they eat it, they digest it, and then guess what they do? They poop out sugar food. So gross. So what you want to make sure you do is help your child understand this, as well as understand how to brush it away, how to clean it away. I'd rather use the word clean than brush. So let me show you guys a little bit closer with my model. Let me put Betty closer. Thanks, Betty. This is a model of a child's mouth, also known as a tetragon. What I want you to focus in on is this is the tooth, your child's tooth, and this is your child's gum. Right between the tooth and the gum, there's a little pocket in here. If you can look at my little instrument, that is where all of the bacteria live, and then that is where they produce all of the plaque. So this is why when we're brushing our teeth, we want to use our toothbrush and point it towards the gums so that we can remove any bacteria and plaque that's hanging out near the gums. If you're looking at your child's mouth, it'll kind of look like cottage cheese a little bit if they have a lot of it. So you want to make sure you're brushing towards the gums in little circles so that you can get rid of all of that. So let's go over some techniques. So I've been getting a lot of questions about when the best time to start brushing your kids' teeth is. Honestly, the best time is right now. Go do it.
What?
Just kidding. But no, seriously. The best time is actually before the first tooth even arises. The reason why is because after your baby feeds, either if they're breastfeeding or if they're taking the bottle, the sugars from the milks actually stay in their mouth. And what you want to do is maybe take like a little gauze like this. Sometimes they have little gauzes with xylitol in them, which is, xylitol is a sugar that bacteria cannot digest. So basically after they eat it, they pop, they die. So you want to take a little gauze, maybe a little bit of warm water, and just clean like this, the gum area. If you can, if the baby's not asleep and you're not afraid of waking them up, you can go inside and go like this, just to remove all of the extra sugars on the teeth. This is for very young kids, kids who start getting their first tooth. Sometimes parents have a really hard time brushing. So the least you want to do is make sure that you're wiping away all of the sugars from the milk that they're eating. Another thing to take into account is the type of toothbrush you will choose for your child. So toothbrushes are usually specific to the age, so they'll have a specific toothbrush if your child is between the ages of 0 to 2. Definitely want to make sure you get a toothbrush that has soft bristles on it so that you don't hurt or damage the gums or the teeth. So now let's talk about toothpaste. The most important thing that I look for in toothpaste, it's not necessarily the brand or the flavor. The most important part is that it has fluoride in it. And in another video, I will debunk fluoride myths that I've heard from parents or social media. But nonetheless, the most important for me is that the toothpaste that you use says fluoride. So you just want to look at it, and usually it'll have it in the front. It will say fluoride. So this is the type of toothpaste you want to start using for your child as soon as you start seeing the first tooth coming into the mouth. And there's different amounts that you want to use depending on how old your child is. So let's say your child is under the age of 3. Under the age of 3, you want to use the size of a rice grain, so about this much, or a smear, sometimes they call it. And so here, so about that much. Not a lot. If your child is above the age of 3, that is when you start using a pea-size amount. So that's about that big. Lastly, about toothpaste, I want to make sure that the parents or the guardians are the ones that are placing the toothpaste on the toothbrush, because I want to make sure you guys use the right amount, as well as making sure that you keep the toothpaste away from reach of your children if they're under 6 years old. So now let's go over the technique of how to brush. I know it's not going to be this easy. I will make another video about tips to handle your crazy screaming kids. But first, let's get our technique down. So what I like to do is I like to be very efficient when I brush teeth. The recommended time is 2 minutes, which seems like forever when you're brushing your little kid's teeth. So as close as you can get it to 2 minutes. I like to have a timer or a song that I know is 2 minutes, so that way we can kind of work together with our baby, with our child, to make sure that they understand when we're done. So what you want to do is take your toothbrush. Make sure that you, as a parent, you have very clean hands. I like to use my pinky to fulcrum, so kind of to have stability. And then I have my child close down a little bit, so that way I can get to this furthest back tooth very easily. I'm directing the toothbrush bristles towards the gums. I'm doing little soft circles, no super hard brushing. And then I'll have my child open, and then I'll do the same thing on the parts of the teeth where they bite. That's where everything gets stuck. Little circles, about 5 to 7 seconds. And then we do the tongue side. The tongue right here, just make sure, I always have my child move their tongue to the opposite side, so that way I can hopefully get right in here and make sure that I clean really well along the margin of the gums, like this. And then I go to the top part, and then I go to the part next to the cheek. And then now we're done brushing the left side. So then you do the same thing for the right side. Thank you guys for joining us today. Let me know if you have any other questions in the comments below. I'll see you next time.